Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Ever wondered why a drug that lowers blood pressure might increase your risk of gout? Let's talk about thiazide diuretics. How they affect uric acid levels in your body, and why they can trigger painful gout flares in some patients. Thiazide diuretics, like hydrochlorothiazide and chlorthalidone, are commonly prescribed to treat high blood pressure and fluid overload. They work in the distal convoluted tubule of the nephron, where they block the sodium chloride importer, leading to increased excretion of sodium and water. This promotes diuresis and helps lower blood pressure. But there's a catch. Thiazides can also raise uric acid levels in the blood, a condition called hyperuricemia. And in some people, this can lead to gout, a type of inflammatory arthritis caused by uric acid crystal deposition in the joints. So, why does this happen? The answer lies upstream, in the proximal tubule. Normally, uric acid is freely filtered at the glomerulus, then partly reabsorbed and secreted in the proximal tubule. The kidneys strike a delicate balance, deciding how much uric acid to keep and how much to eliminate through urine. But thiazides disrupt this balance. Although their main site of action is the distal tubule, thiazides also act in the proximal convoluted tubule, where they interfere with uric acid handling. Let's break it down. Inside the proximal tubule, specific transporters manage the reabsorption and secretion of uric acid. Two key players in this process are organic anion transporter 1, or OAT1 on the basolateral membrane, and OAT4 on the apical, or luminal membrane. Here's how thiazides disrupt things. On the basolateral side, thiazides enter the renal tubular cell from the blood via OAT1. Normally, OAT1 helps shuttle uric acid from the bloodstream into proximal tubule cells, in exchange for other anions. But when thiazides are present, they compete with urate for transport. This competition reduces the amount of uric acid entering the cell. So, more uric acid stays in the blood. On the luminal side of the proximal tubule cell, thiazides also interact with OAT4, an anion exchanger embedded in the apical membrane. This transporter swaps thiazide molecules for uric acid, effectively reabsorbing urate from the urine back into the cell. As urate accumulates inside the cell, it can then cross the basolateral membrane into the interstitium, ultimately raising serum uric acid levels. But that's not the whole story. Thiazides can cause mild volume depletion, which signals the kidneys to conserve fluid by increasing reabsorption in the proximal tubule, including reabsorbing more uric acid. So, it's a triple hit. Thiazides reduce uric acid secretion via OAT1. They also increase uric acid reabsorption via OAT4. And they enhance overall urate reabsorption through volume depletion. The end result? Elevated serum uric acid levels, and in susceptible patients, gout flares, often starting in the big toe. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.